All right, everyone. Good morning. We'll start in. This is Mark Ferrari, and it's my pleasure today to introduce today's topic. Today's primary speaker is Dan Cummins. Dan is Director of Information Security at Westchester Medical Center Health, working with the organization's CIO and CISO in programs and controls management. Dan's been following security technology as an industry and equity analyst since 2001. And prior to going on board with Westchester, Dan worked at 451 Research, covering network and data center security technologies. Dan is a certified information system security professional, and I'll turn it over to him. I may jump in periodically during the presentation. We are recording this presentation, and we ask that everyone stay on mute and hold your questions till the end of the presentation. I'm sure we'll have time at the end to open it up for questions and discussion. So Dan, thanks for being here, and I'll hand it over to you.
Thank you, Mark. And also, I just want to say thank you for being a good partner this year. Mark joined the security program as our CISO early in the second quarter, and this has been a tough year, and that's what this talk is about. Primarily, some of the highlights from our own version of the year 2020 on the security program at Westchester Medical Center and WMC Health, referring to our network. We were undergoing some big changes on the security program and in IT generally broadly prior to COVID. That forms an interesting backdrop that we'll reference a couple times here. But primarily today, we wanted to talk about what worked for us. I think that's the best use of your time listening to me speak, and some lessons learned along the way. I'm sorry, I've just gotta get my slides to advance here. There we go. Just quickly about WMC Health. Westchester Medical Center in Valhalla, New York, about 20 miles north of the city, 25 miles north of Manhattan, but not far from the northern boroughs of the city. It's less than the main hospital. Comprises what used to be the county the county hospital. Westchester Medical Center now is the hub of a fairly significant suburban rural health network. It's pretty well branded in the Hudson Valley, although we have a lot of healthy competition. As I said, it's a little less than 2,000 beds. We run a few data centers, and the workforce is about 12,000 people. I think I'd put the on payroll number at 8,000, 8,500. So we have a healthy percentage of partners, including regular outsourced partners that come to work here every day, or they work remotely every day. And our IT is now managed as of about just under 2 years ago. Our IT is managed by our primary EHR partner, that being Cerner. And as it's a network that was put together starting in 2005, as I said, off of leveraging the old transformation of what was Grasslands Hospital, the county hospital. And we have a different look, I'd say, about every 5 years as a result of M&A. And we'll have a pretty significant new look in 2021 and 2022 as we absorb other parts of the network where we have majority control, but we're not really there yet operationally. So, more to come on that. But that's a big part of the security program as the operational look of the hospital changes, as I said, about every 5 years. So the security program, this is to give you a flavor of people, process, and technology here. Up on the left, shaded red, not because it's so such a mess or it's on fire, but this is kind of the immediate everyday pressure of working in an heavily outsourced IT environment We are a high trust certified organization. That is the network as of mid 2019, and we passed our first interim assessment in the second quarter of 2020. And I think third-party risk management, the onboarding, that's a big operational challenge day to day. Latitude does a great job working with us directly as our outsourced partner for that element of the security program. And it has pretty wide visibility across the whole company, the whole enterprise. And I'd say detection and response, that's been our biggest ongoing challenge, I think, since I got here in 2017. So maybe the red section should bleed down a little bit more there, covering detection and response, and the rest, the same old problems of working in a big organization, wanting to do more, having that accountability, obviously, for security measures, but the authority to really run the business rests with the clinical heads and the clinical operations. So it's a tough balance in healthcare. Um, Show you some of the other major projects going on for more than a year. We had, I think we're on our second or third, I would call it failed deployment of endpoint protection. We're going to make a move soon to get to something better. Mark's team's helping a great deal, obviously, with that. We had a failed network security as a service deployment. So we're moving on from that. I think in a lot of cases you'll see, particularly if you're picking good lightweight technologies that you can swap out of, fail fast and move on. We have found that to be a good way to operate. We're not really resource rich money wise or with people. But I think if we continue to spend our money carefully on the high dollar vendors and the high dollar functional technologies that we really need, I think we'll remain, I think, pretty strong, resilient, but most of all, agile and able to move on from something that's not working as well as it should to something better. When COVID came along what was that, the very late part of calendar 1Q, we had to reorient priorities pretty quickly, obviously. So I've circled the ones that became just, kind of my hair's on fire urgent. And as I said, we were feathering in a new primary security program partner in Latitude at the same time. Mark can talk a little bit about that. In fact, when I get towards the end of this slide, I would like to hear from Mark about those early days coming in, particularly with all of us literally scattered and trying to continue to run the security program remotely, but also trying to get the whole organization up and running smoothly remotely. So a couple things that really came up very quickly as immediately challenging as the operational priorities of the hospital. The clinical priorities also changed overnight, onboarding a lot of technologies with COVID urgency, trying to really support robust access management. We had a couple of access projects going on already. We've been trying to consolidate, to really create a good, strong bottleneck with our remote gateways. We've been flirting with MFA vendors a long time. We did a pilot with Imprivata. We piloted with Duo more than 2 years ago. We kind of knew what we wanted, but maybe still just sitting on our hands a bit. As I said, we do have an urgent need for network security as a service. So we had made the decision to move on from one vendor, and they were kind of almost just about gone when COVID came along. So at the same time, we were also sort of firing our endpoint vendor. So a real urgent need to move quickly and with some replacement technologies. Microsoft, fortunately, I think, has provided a pretty good backstop in between. One of the big immediate impacts for Latitude, I will tell you, has been our risk management cycle. Obviously, originating with the monthly vulnerability scans. There's so much work to be done just in regular hygiene. So bringing in a new coach, a new voice, Some really forceful message on accountability has been great. I really do appreciate that, working with the Latitude guys. And things are getting better, but we still have a long way to go. And over here on the right, we're much more oriented at a higher level, appropriately on risk rather than the nagging little day-to-day things, and being able to work in terms of a logical priority. Risk-driven is a big help, particularly at the resource level at which we operate. And obviously, there's been just a crush of new threats, and just the email volumes associated with COVID, and being able to having a lot of urgency, but being able to project a new urgent urgent messaging around employee awareness and the need to be really savvy with your email. The analogy I like to use with email is, if you can remember, as I do, late elementary school and middle school, and the teachers who really did a good job identifying sort of those risky individuals that could disrupt the class. Don't let that kid sit near the window, the open window. Bring him forward, put him in the front row. That's the kind of urgency we're talking about now with phishing. And this latest these ransomware risks, obviously they're frightening. This is existential stuff. This is out of business risk we're talking about now, and that's all balled up in these COVID prioritizations to the IT program and to the security program in general. Now, having said all that, I feel like I've somehow trivialized what was really happening here on the ground in March and April, and into May, early part of summer. These were the daily trials of so many people, so many dedicated people had to come to the campus. This is a huge public safety campus, the campus on which the main medical center sits here in Valhalla. And our CIO, who had been also fulfilling the CISO role, very dedicated to a daily stand-up call and reviewing an amazing series of tasks that would take place over the prior 24 hours and the next 24 hours. Obviously, being able to comply with the governor's order to expand bed capacity by 50% on very short notice. A real heavy daily and around-the-clock series of project management tasks had to get done, focusing, of course, on workforce safety at the same time, being able to pivot real fast towards a designation of who's non-essential. Those non-essential people had to get off the campus and out of the way, in some cases, to make way for the bed capacity expansion or the testing center that was thrown up, both here and in Poughkeepsie. The workforce mobilization it was obviously very impressive, and it put a lot of strain on all of our IT resources and IT logistics. And for us, having to coordinate and control work from home seemed, not small, but obviously not nearly as fundamentally important as the mission of the organization. In terms of coordinating work from home, as I said, we had an ongoing project to bolster both the security and the capacity of our remote gateway and consolidate down to a few strong bottlenecks. And so we continued to do that while monitoring an expansion in capacity. And as I said, we had been keeping our eyes on a couple of technologies that we wanted to get in here. We've been talking about an identity platform for a long time, and obviously talking about multi-factor authentication. Multi-factor authentication is spelled out in HITRUST. It's something that you will do as appropriate. And for us, you just can't have policies that you're not able to comply with. You're in the breach if you're not able to comply with that policy. So we decided just to make the decision to move as quickly as we could with respect to multi-factor authentication. And I thought, oh my God, that Imprivata stuff that we looked at, it's I know Imprivata is a great set of technologies in the clinical realm, but we need something that's broadly about all IT with MFA. And there's like any other functional product and service in security, there's a series of winners and losers out there, and we are always now going forward. As Mark will tell you, always in discussion with a small handful of, I call them their enterprise peer partners, names like VMware, Microsoft, Cisco, maybe one or two more. And it's now a series of rolling enterprise agreements with these vendors. Some of them have 1-year term or 2-year term, 3-year term. And I think when we looked at the possibility of folding in Duo, I think we were really enamored of that idea, having had a good experience with a proof of concept trial. So I'll get back to that in a moment. I wanted to just talk about how we approach technology and the program and expanding our capability. And I think we call this like the four-way mirror of monitoring our own capabilities functionally. This is something that it's useful because we have such limited resources on the security team, but more broadly on the IT team. I don't think we spend anywhere up near our benchmarks industry-wise. And I think that's been to our credit, but there's obviously some risk that goes with that. But the really compelling need to complete a transformational migration to Cerner Millennium has really forced us to put some things off. That's almost done, and we're underway. So I think we can circle back and have a really great year in terms of adding controls in 2021 and 22. But I wanted to let you know about just how we kind of go about thinking about value, how we will extend and project our expertise, our capability. What do we need in terms of support? What can we project to our whole organization in terms of our capability? And do we have everything? Are we doing everything we need to do in terms of the governance backdrop that really underpins a security program? So we probably have as many governance, compelling governance needs as we do straight security functional needs here at Westchester. Control-wise, I think we're coming along. I think HITRUST has been superbly useful for that. It guides our prioritizations. Frankly, it helps us project a much more serious tone across our organization and get some attention that we need to demand in some cases from other groups. Healthcare is still painfully top-down command and control, where a process orientation would be better. So HITRUST really does help with that. In terms of visibility, this is the thing I harp on a lot. This is dollar-wise, this is where you want to spend your money. This is the number one prized capability in terms of seeking out technologies. This is where you get value. We tell people, because you can't know if you just can't see it. And we tell our new hires on day one, to know and not to act is to not know. Like, what's the point, right? So we focus a lot on visibility. We have a couple of vendors where we just can't play that, I can't afford you kind of thing. We have to have it because it's the best and it provides, utmost visibility. And it's best that we don't talk in real specific terms, with vendor names. We can do that offline if you'd like. The one we will talk about today, though, of course, is Duo. And time to value. As I said, for us, that's what works, because we might love you today, but for whatever reason, we might not in 6 or 9 months, and we're going to need to move on. And so working with lightweight technologies, getting time to value quickly so we know, did we hit our marks? Did we achieve our objectives? That's important here. So let's just talk about multi-factor authentication. I checked some numbers. As I said, as Mark said, I was a 451 industry analyst. They're sort of, they were similar to Gartner, but they focus primarily on innovation and startups. They're now owned by S&P as of a few months ago, and they do have great numbers on security adoption. And I was shocked. I mean, I've wanted multi-factor authentication here since I got here in 2017. And I was just assuming that everybody else had it. I know of famous successful implementations of Duo, for example, at other hospitals nearby. But the actual adoption rate of MFA is surprisingly low, according to 451. This is from a few months ago. It's at 53%. I would have thought much higher. Now, they also indicate that about another 25% of those surveyed are implementing it right now, probably for the same reasons that we did around the compelling working from home requirement and the need to support it. But the adoption rate for that still, it strikes me as a technology that should be up there with sort of those near universal things like firewall, endpoint, and those, just because the data is just so compelling around how account compromise happens, right? A loss of a legitimate credential, the user ID and the password. Passwords are pathetic, as we all know. And then, of course, the ease with which employees are exposed to, kind of the rough ways of the internet through phishing. So multi-factor authentication, to me, it's a no-brainer. And the really good news is that Microsoft has, kind of seen to make this a pretty universal technology. If you have a Google Mail account, you know how easy it is to implement their second factor authentication. So it's becoming table stakes. It can be delivered through the infrastructure provider like Microsoft, Google, and so forth. Duo was a great overlay. And as I said, we piloted with it 2 years ago. It's a perfect fit for what we wanted to do to strengthen our remote gateways. I worry a lot about stolen laptops, particularly for top executives. And multi-factor authentication, that's an easy way to protect that executive out of the office. But I do worry a lot about what a stolen device can mean risk-wise to a sophisticated criminal with a lot of time. Because in some cases, you might think they steal the device and then try to get the password, but I think it's the other way around. The criminals get these user IDs and passwords, and then it's probably child's play to hire a professional burglar to go get a couple of laptops. This is one thing I've learned is the sophistication of the research and the tactics. These campaigns, they unfold over months, not days, for the best of these very organized criminals. MFA in Duo's case provided us a lot of enhanced visibility about our remote gateways. We have a huge Citrix deployment. We're about 70% virtual, and that number moves in 5% increments here month over month. We've got a brilliant architect on board, and but a lot of our Citrix deployment is actually on premise, and Citrix does not make a great deal of distinction between external and internal IPs. It wasn't set up for that. So having a Duo in there has been a really good level up in terms of our visibility on remote users and their behaviors. Their analytics that come bundled with the product are brilliant. And finally, for MFA, our first use case, our most important use case this year in 2020 is remote connectivity, working from home, working remotely, but our partners work remotely too. So this is something we've needed for a long time, and it's a perfect complement to some of our existing projects underway in terms of that bottleneck I was describing. But also, MFA obviously has great extensibility into protecting your financial portals and the people, the workforce that uses those. Any third-party portal. If you have a tool that can control and actually get those use markers off of the internet because they're out there. You can help you control backdoor IT much more efficiently. And longer term, look, MFA, it's probably its best and dynamic use case for stepped up authentication is something that we'll do when we get very good at it and we finish the first primary use cases beyond remote work. Things I just mentioned, but I also wanted to mention, we've talked a little bit here, I've referenced our desire to have an identity platform, and that'll be a big one for us, I think, in 2021, 2022. We are continuing to stand up a number of foundational Cisco security technologies. We are a Cisco shop primarily at an infrastructure level on the network, but being able to go further with device posturing, we could perhaps use Duo for that. We could use Duo for some elements of MDM, and I think we're excited about what we're getting here. And as I said, working from home is still against policy here. It's amazing, and it's probably still true in a lot of healthcare. So adopting working from home, as I call it, is kind of a campaign that we're kind of quietly supporting and working here, but it's still against policy, strictly speaking. And we've had to help out in terms of crafting a full kind of standalone work from home policy. What that means, both in terms of protecting data, but also protecting the device and the network privilege that comes along with that. So that's a big deal here in terms of kind of the new ways of thinking about work, and obviously being very robust about how we're able to scale up and scale down, because it probably will happen again, as we're all kind of feeling right now, the second wave and so forth. I'm wondering how HR is coming with kind of a regular designation of non-essential workforce. So all things for us to consider operationally and going forward. So we had a whole bunch of things pushed aside here, and this will be a good opportunity. I'm sorry, I lost my train of thought. I did want to pivot to Mark here for a moment, but the things that we were working on as COVID happened and as Latitude was beginning to onboard, we had a sweeping adoption of Cerner Millennium going on. We had a high pressure financial audit going on that we had to, make good on in terms of artifact collection, as well as the high trust interim assessment. As I told you, we kind of have a new rolling new look with respect to M&A that we're always having to prepare for, and of course more and more cloud adoption. And I think we feel that pressure a lot with respect to third party. So leading up to, I'll call it May 1st, Mark and I had a series of daily conference calls talking about a wide range of stuff culturally, and right on the cusp of COVID. COVID was starting to really happen, and then boom, I was working remotely. So I think this would be a great opportunity just to kind of remember those days, because these things that are things right now that we're circling back to, particularly beefing up endpoint protection, finishing our new implementation of network security as a service. So Mark, opportunity for you to provide some color and comments, and then I'll continue.
Sure, happy to. Yeah, and a lot of as Dan was speaking, I certainly remember, as much as I tried to block out those days, I certainly remember them clearly, because there was a lot going on, and I think part of the wisdom of the Westchester security program, and between Dan and Steve, the CIO, was to appropriately staff from a governance and program management standpoint, and I think that as the saying goes, when you chase two rabbits, you catch neither. So adding some staff to be able to focus on things from a specific level, allows Dan to chase one rabbit, allows me or other folks that we've brought in to chase others, and I think we're now starting to see some traction there. Amid that, as Dan had mentioned, we basically were jumping on a rapidly moving bullet train that had to very rapidly hit the brakes for several items, such as changes to the working structure for COVID, the continual advancement of VDI, and then, of course, the big one, which was the Cerner Millennium implementation. So, a lot of fits and starts, so to speak, but the challenge has been to keep the pressure on those priorities, now that we're approaching the other side of the Cerner EHR implementation, now we get to grab, get some traction again. So there were a lot of things going on, and a lot of organizations. Medical device being managed by one organization, IT infrastructure being managed by another, security, of course, being managed by yet another. And so, there was a lot of puzzle pieces to put together. All the while, the picture that we were trying to assemble with that puzzle was changing. So, it was a very dynamic time and continues to be. In that, there was one constant, and I think it was that Duo implementation, which is kind of one of the, COVID's a double-edged sword in a lot of ways. One of the, I shudder to say one of the benefits of COVID for obvious reasons, but one of the things that COVID did push in terms of accelerating was this multi-factor authentication rollout because of the push to remote, such a broad-based remote workforce. And so, that did catch the attention and catch the priority that it needed. MFA is, of course, important on a good day, but when you have folks in the middle of a crisis having to work from here, there, and everywhere, it's a must-have. And so, Westchester did move very quickly on that, and I think Dan enjoyed a very good implementation with a lot of good support from Duo as a partner.
Great segue, because that's true. That's all obviously true. I do want to talk about kind of what was normal, and just the really brilliant delivery of capability that Duo was able to provide. Now it's obviously, it can be taken as a plug for Duo, but my more important message is that you can find these capabilities in vendors with a little bit of Google searching, asking around, but stay very focused on sort of insisting that you meet your requirements. Okay, so for us, we just always need more arms and legs, obviously, and with Duo, they had an unbelievable team, right? So it's a startup of some notoriety out of Ann Arbor, I believe. They came from Arbor Networks, great backgrounds, and somehow they're able to preserve their culture even as part of Cisco thus far, and that's unusual. It's not impossible. It can be done, particularly if you had a very forceful, visionary leader, which they did. So they were able to step in and help out at a tremendous level in terms of the formal project management of implementing Duo. Unbelievable sets of daily notes would be in our inboxes, minutes after lengthy conference calls ended. And I'll tell you in a minute about what our configuration period was like day to day. Duo, I think, has normally about a 17-week configuration and deployment template that they'll offer. We wanted to get it done in 2 to 4 weeks. We didn't quite hit, but we did manage to get it out there in 4 to 6 weeks. But we were able to stand up one point of integration in 2 weeks. And the way we were able to do that was we had everyday conference calls that lasted anywhere from 2 to 7 hours with these amazing Duo care guys that were appointed to work with us. Now, we did not buy Duo through our enterprise agreement, which was still in negotiation with Cisco, but we got, nor did we pay, top dollar. I think they were really reasonable on the economics, but they just made us feel like this is the way we work and we're here for you. So unbelievable commitment to customer care. And it was, we called them the Adams. There was 2 guys named Adam, and one guy was very good on the business requirements. The other guy was obviously a technical ace, which we needed, but we had a great technical ace on our side. And those guys worked tirelessly over a period of 2 weeks to make it happen. And they positioned us for a full, and I mean full, rollout to the whole hospital in 6 weeks. We went live around June 1st, and we had been running a pilot for most of after week 2. We were in pilot, and we were ready to go for the whole hospital in 6 weeks, and we're very proud of that. But that didn't come without a few other challenges. And the other things that were happening were related to COVID. We did see a couple of fraudy vendors that we were asked to look at as far as third-party risk management that we didn't move forward with. Grateful to have caught it, but that's kind of routine now. But legal does a good job. Our procurement people do a good job, but the volume of reviews for third-party risk management just went up and to the right. And as I said, Latitude came in and did a great job both taming what had gotten pretty unwieldy and nearly out of control, but also coping with a huge volume of COVID-related new requests for onboarding. That's the full security review and making some good recommendations and prescribing requirements for if we're going to work with these guys or this technology or this device. And as I said, just keeping up with the concurrent capacity requirements on our gateways was a big day-to-day challenge. So the unseen challenges was, again, just not having enough of our own resources to throw at Duo. But again, we had a vendor that just had uncommon grace and capability to fill in the void. And we're really, truly grateful for that. That's why I'm willing to sing their praises. There are a number of interesting industry analysts have gone to work at Duo. One of the really noteworthy ones is a woman named Wendy Nather. And in her time as an industry analyst, she had a catchy phrase about security technology. I think specifically she was talking about threat intelligence, but more broadly, it's a reference to all very, very good security technology. And her question was really just, is it only for the 1%? Security technology needs the same sweeping democratization that has happened all over software. Things like Salesforce.com. Zoom is the latest, greatest example. Would you rather use Zoom or would you rather use WebEx? Have you tried to train people on both? I have. It's kind of my night job here on the IT team. So Duo is just one of those amazing stories of frictionless adoption, right? It's technically obviously very deep and robust, but once you get it working and stood up, it's frictionless. It can be put in line to recognize your employees, and they can self-enroll. It's really helpful with that, and particularly in an organization such as our own, where engagement is a challenge. The rules of engagement, particularly for the clinical workforce, are very tightly controlled here by hospital leadership. It's just that's our culture, and that's what works here. And kind of working with hospital leadership on the end user communications piece took way more time than we had imagined. Duo has a really deep and rich support content. It's one of those companies that invested very successfully in a marketing hub, but we were not allowed to use those materials. We weren't prohibited by Duo. We were as I said, our hospital leadership was insisting on something that we would author. And we had, unfortunately, kind of shifting requirements. First, we were at 12 pages and 10 pages, and right before we went to we were going live, we were told it has to be 2 to 3 pages. So a lot of pressure and a lot of rework just on end user communications. And as I said before, there really is no lean here still towards working from home. There's no policy supporting it. So we have to be a little bit careful about talking about Duo. Hey, we have this great thing that supports work from home. It's obviously very safe, and you protect your credentials. But culturally, we're not there yet. So we're looking to move quickly beyond protecting remote gateways to the next set of good use cases for the technology. And then just the last point, it should have been the last bullet, but it's the third bullet here. We have some legacy technologies here. Duo is very much a web technology, and I won't say it's easy to integrate, but it's fairly simple. That's their ways are set up to support web technologies very quickly and elegantly, and you get a great user experience. If you have to use some older client server technologies, it's going to take you a little bit more time, and your user experience is a little bit diminished. But again, they were very, very helpful for that. But that was probably the reason for the 4 to 7 hour conference calls, those daily stand-ups that we were doing with them on configuration, much more so than the web technologies. So just looking ahead, and really appreciate everybody's patience getting to Q&A. We obviously want to get beyond protecting remote connectivity and getting towards more use cases, particularly those third-party portals. That's backdoor IT, as they call it. I think we have more than 60 partners for our revenue cycle, credentials for which are not controlled through our identity platform. So that's a great concern. We want to really unify on the best available access technologies, and get positioned to put in place a really strong identity platform, finish some of the infrastructure work we're doing with Cisco, and then look beyond to best of breed to build a strong identity platform. And my wish is that culturally we can kind of break through and accommodate a number of work styles, including on-prem, in the office here. I just feel like it would be healthy for my organization, and that's my big hope. Pivoting off of Duo, and then obviously branching to a lot of other good technologies as well. Obviously, I'll give Mark an opportunity to wrap up as well before we get to Q&A. But thank you very much for kind of this long-winded chalk talk on our version of 2020 here.
Yeah, thank you, Dan. I appreciate you agreeing to do it, and I think it's the type of honestly, it's the type of talk that I hope can only help other organizations in terms of kind of laying out, hey, this is not only where our program is, but let's take the example of one specific implementation, very rapidly for COVID in the Duo implementation, and I hope there's some lessons and some, maybe some pain points that people identify with, and maybe some same direction. So, I appreciate the frankly, the open and honest discussion around, hey, this is our program, and this is, this is the good, this is the bad, this is the ugly, and this is where we're going with it. So again, thank you for jumping on and doing that. I'll open with a question, and then as other folks have them, if they could, just go off mute. I think there's a reasonable enough folks, amount of people on that we can accommodate that. But Dan, I think that, as a spectator to this project, and for those on the call, Dan was the driver of this project from Westchester's standpoint. Communication seemed to be probably the front and center item that you placed a lot of time and effort into managing. In terms of putting out an organization-wide communication around this implementation, the fact that folks would have to take certain steps on their own to self-enroll, and that it's change, and it's change amid a time of crisis. Tell us about some of those challenges and some of the the ways that what was put out there, and how that was received.
Right. So I think it was helpful. Obviously, blitzing the Duo support pages. So we created a number of documents. We created extensive documentation for the support desks, the help desks. Those are run by Cerner IT Works. So we had a version for those people on the help desk that were actually deputized and anointed as administrators of Duo. And there's a couple different levels of administrator. Duo provides great administrator training out of the can, videos and live training. We had to create a version of support documentation for regular help desk people, which number in the hundreds at Cerner IT Works. And then we focused, of course, on end user communications. And as I said, we got compressed down over time tremendously. We had every imaginable screenshot, kind of leaving nothing to chance. I borrowed heavily from some documentation I had seen at New York Presbyterian. Some friends of mine, believe it or not, had worked on it. And so we kind of went with that as our model. What remained in the end, I'll tell you, was probably a page plus of explaining to people, why are we doing this? And that made perfect sense when I really stepped back and thought about it. I really didn't have a lot to sweat in terms of the Duo part of it. It steps you through it. It's brilliant. It really does work. I'm happy to jump on and whenever somebody kind of calls me because they know I can help with Duo. I'm still an administrator. I got a new phone, or this is happening, that's happening. Those things are easy problems to solve. The harder problem, I think, and people appreciated this, was why are we doing this? What is multi-factor authentication? What are the risks? Being able to explain to people that hospitals are being taken down by criminals because your credentials are falling into the wrong hands. And it's you talk people through that, and what could account compromise mean for the hospital and for patients. It's always good to remind people that it's well proven in the data now that a takedown has and it's not even hard to imagine, tangible, direct impacts to patient care, health outcomes. So focus a lot on, why are we doing this? If it's affecting me, here's why we're doing it. And that helped. I was able to believe that a 2.5 page document would do the trick. I didn't initially, because Duo was sort of offering so much in terms of very well expressed, clear information. Isn't it easy just to adapt this to a document? And then we were, there was just this feeling that nobody's really even going to look at the first 2 pages of a 12-page document. They're going to be overwhelmed. So, lightweight really was, I had to be convinced of it, but it was definitely the right way to go.
Great, thanks. All right, we'll open it up now to see if there's any questions from anyone else. If you could just kind of unmute yourself and fire away.
Mark, looks like Dan did a great job
Absolutely.
in being able to explain everything. And I'd like to thank you and Nick as chair for the PCS committee for putting this together. Look forward to next month's presentation. I'd also like to remind everybody that on November 12th, this is the year of the nurse, and the nurses will be putting on a virtual event, 2020 Nursing Innovations, Stories from the Front Line. So we'll look forward to seeing everybody being able to hear what the nurses had to go through during this period in time. So again, I'd like to thank Dan, Mark, and Nick. Great job this morning We appreciate the help. This
welcome. Thank
recording will be available both on our website as well as on our YouTube page that the New York chapter has. So if anybody couldn't make it this morning, we'll send a notification out so others can come and join. Any closing remarks, Mark?
None for me. Again, I'll just thank Dan again for taking the time to share this experience. I think this is the type of stuff we want to, propagate and hear from different organizations, what worked well, what challenges they had. And so I think this was the type of conversation that I'd love to continue to have on these sessions.
Thank you. Thanks for listening, everyone.
Stay safe, stay healthy, everybody, and come and join us at our next event.
Thank you, everyone.
All right. Thank you, Dan. Thank you, Mark. Thank you, Tony. Thanks, everyone. Bye-bye.
Bye-bye.